Hello, good morning, everyone. Welcome to this webinar. On behalf of the Grundfos Foundation and Copenhagen University, it's my pleasure to welcome you all today. The foundation discovered recently that in many of our community water projects, where the beneficiaries have enough water available, they only use around 5 liters per person per day, which is a very small quantity compared to the health recommendation of 20 liters as an absolute minimum for drinking, cooking, cleaning, and personal hygiene. That's why we wanted to increase focus on the link between water use and the public health. In this session, our 2 speakers will present 2 case studies connecting water stress and overconsumption with health and social issues. The session is structured with 20 minutes of presentation and 5 minutes for Q&A, and I encourage you to submit your questions for the speakers in the chat module. I'll select a few for our speakers to answer. After the session, we'll try to catch up on any unanswered questions in the chat. And I'll introduce the speakers quickly. If Gifty, if you can change the slide, please.
Yeah.
So our speakers today will be Dr. Gifty Sunkwa-Mills, who's a Municipal Director of Health in Ghana Health Service, and hopefully, if we can get him on board, Professor Flemming Konradsen of the School of Global Health in the University of Copenhagen. And in case he's not able to connect, Gifty will take over his part of the presentation. So I'm going to leave the presentation with you, Gifty. Welcome and enjoy.
Thank you very much. And good morning, good afternoon, good evening, everyone, depending on where you are. My name is Gifty, and I'll be sharing some findings this morning on an ethnographic study of healthcare-associated infections in Ghana, a case study in the Kolebu Teaching Hospital, which is part of my PhD project. Now, every one of us will at some point in our lives be a patient in a hospital. And whereas we expect that hospitals will leave patients better off a state than they came in on admission, this is not always the case because of hospital-acquired infections. Healthcare-associated infections are a tragic consequence of healthcare delivery. They are a patient safety issue globally. And this study in the Kolebu Teaching Hospital, which took place in the surgical units and the neonatal intensive care units, help us to get a picture of what happens in low middle income countries. The Kolebu Teaching Hospital is a 2,000-bed capacity hospital, which is a major referral center in Ghana, taking cases of surgery, maternity, and all kinds from all over Ghana. Now, global efforts to reduce healthcare-associated infections are mainly focused on improving infection prevention and control practices. These include hand hygiene, cleaning and disinfection, waste management, and so on. One thing that is central to all these practices is the presence of water. Water is central to a patient's experience of healthcare. Once a patient enters the hospital, everything from cleaning to personal hygiene to laundry has something to do with water. In our study where we use participants' observation and in-depth interviews, we realized that in the absence of water, so many standards were compromised. For instance, when it comes to cleaning, we find a cleaner, for instance, using a mop with a bucket of water and a little disinfectant to clean the entire length of a hospital corridor, as well as the wards. These mops, after being used, may not be even rinsed out properly. They are just hung in the sun, as you can see in this picture. And then in the course of the day, when there's a spillage of blood or body fluids, a cleaner would just grab a mop and use it to clean and may not even rinse it properly. This could predispose to infections. Now, when it comes to hospital laundry, in the absence of water, laundry may be piled up for some days before it is done. This creates a shortage of clean bed linen on the hospital wards. So whereas we might expect patients to get a clean bed sheet every day, this is not actually the case. It becomes a negotiation as to who has a dirty bed sheet that needs to be changed, or who has used the bed sheets for 2 or 3 or more days before a patient gets a change of linen. Similarly, with healthcare workers, in our interviews with them, they told us that sometimes even performing hand hygiene is a challenge, especially when, for instance, a sink is not functioning. So on an entire ward where there is a sink at the extreme end of the ward, after seeing a patient, the health worker will have to go out of the ward and walk a distance to access a functional sink with soap, water, and towel to wash their hands. This is quite discouraging and this takes time. So they end up sometimes seeing 2-3 patients before washing their hands, which is clearly a compromise on infection control standards. Hand hygiene facilities are usually inadequate in these facilities. For example, in the neonatal unit, sometimes we would find sinks non-functional, water not running, and tissue and soap not readily available, or where they are available, there are cautionary stickers saying, be careful, just take one at a time, or use the soap with discretion. In the same way, due to poor maintenance of facilities, you might find toilets broken down, sinks broken down, and because there is not enough water to usually flush toilets, which will take about 7 liters per person per use, these toilets end up getting clogged. In the same way, the drains end up getting clogged, and then there is pressure on the few functional toilets and sinks which are left behind. A common sight is to see water stored in buckets or other containers, which themselves can be a source of infection when they are not cleaned well. On other occasions, water which is used for cleaning, which is dirty water, may be used for flushing toilets because clean water is not available. And once again, due to lack of policies and guidelines, when cleaners are cleaning, they use their own discretion to determine what is dirty and when the water is ready to be changed. So a bowl of water could be used to clean several surfaces. And the issue is that, do these surfaces end up really clean? We estimate that an outpatient should need about 5 liters of water, an inpatient about 40 to 60 liters of water, and when it comes to operating theaters, about 100 liters. In outbreaks or hemorrhagic fevers, maybe about 300 to 400 liters. But the issue is these quantities look like a luxury in this setting where water is not readily available and water often has to be purchased to be put in storage tanks, or sometimes sachets of water have to be purchased to use for hand hygiene and other uses. All these scenarios have a potential to result in poor compliance with protocols. In my own experience during the study, I was washing my hands at a point, and then suddenly when my hands were lathered with soap, the tap stopped running, and therefore I had to rely on somebody to get me water to complete the hand washing. Somebody may just end up by rubbing their hands in their clothes or their aprons when water is not available or towels are not available to clean the hands. All these instances predispose to a higher rate of infections, and these come with a cost because patients stay longer, use more antibiotics when there are extra infections, and this could also result in antimicrobial resistance. The substandard cleaning and environmental contamination can lead to outbreaks, which are not a desirable situation at all in a hospital setting. It is important that to maximize water use and minimize infection rates, there is resource prioritization. Wash infrastructure must be an important part of the annual budget of the hospital, and there must actually be implementation. Hospital must be assessed based on how much they are investing in these important areas. Proper handling of medical devices must be done, and staff must be trained, especially the cleaners. We realize that most workshops do not include the cleaners, and they are not made to feel important, but their work in the hospital is so important. So if these hospital cleaners are acknowledged for their great work and they are trained and there is sufficient staffing, it will help to improve the situation. Healthcare workers also need to be given appropriate reminders, such as them reminding each other it's one way. And also during our research, whenever we gave them feedback, we realized that it was important for them. It helped them to improve their hand hygiene practices. It is so important to understand the drivers for wash behavior change in the hospital context. Healthcare workers, for instance, are appraised on a yearly basis. If infection control is made an important part of this appraisal, for instance, they would appreciate that it is very high priority and pay attention to it. In all this, there is a need for a firm focus on patient safety, that when patients come into the hospital, they need to go out in a better state than they came in. Appreciating this will help take the necessary steps to improve quality of care in the hospital. I'll now hand over to Flemming to continue the presentation. Thank you for your attention.
Thank you so much, Gifty, and sorry being late comer. Maybe you could shift to the next slide.
Sure.
So from lack of water at hospitals, we are moving into quite a different environment. Here we are talking about hotels on tropical, subtropical islands where we have monitored water use for a number of years. One of these places we have done so is on Zanzibar. Here we are looking at coastal tourism on the main island in Zanzibar. So next slide, please, Gifty. So water use at hotels is quite intense. And this is not just bars and restaurants and cafes and so on. The major water users are associated with laundry, not as we just were explained at hospitals, there might be limited access to laundry, but at hotels there are plenty. So lots and lots of water are used for that purpose. Also bathrooms, showers. Tourists have a habit of showering whenever they have been into the seawater, before and after swimming pool, before going to the restaurant in the evenings and so on. So significant water use linked with showering. Also, we see some of these very beautiful lawns and campuses, hotel compounds, where there's enormous use of water for irrigation or horticultural activities. Next slide. So some of these estimates we have been able to do ourselves, and some of them are also from other studies. We can see community use in the coastal areas being quite wide, but down to 25 up to 90 liters per person per 24 hours. That's quite a different story when we move into the tourist areas, into the resort areas or the smaller guest houses. Guest houses, 200 to 600 freshwater liters per day. 3-star hotels, 300 to 800 liters. And the most impressive, large and beautiful 5-star hotels, it can actually be up to 3,000 liters per tourist per 24 hours. So an incredible difference, and also an overall significant use of freshwater resources. Next one, Gifty. So of course we see an impact of this significant water use. Gifty just explained about the hospitals, and we have the same on Zanzibar. You can have nearby health centers and hospitals with very little water availability, and a few hundred meters down the road we have these hotels with excess use of water. This of course it creates a competition between the hotels and other users. So hotels have much better infrastructure, larger pumping capacity, willingness to pay for money, so they outcompete other water users. We also see in the nearby, the coastal areas, that significant groundwater pumping results in saltwater intrusion. We also see conflicts arising between hotels and nearby communities when they're being outcompeted by the hotels in accessing water. And of course, this has implications on the communities in the sense that the agricultural, livestock, horticultural and business opportunities in general are being hampered by lack of freshwater access. It also impacts on community environmental health standards. So some of the same issues that Gifty brought up just before in terms of hygiene related health problems, you will also be facing in these communities. It also does undermine the investments in the whole tourist sector, specifically the hotel sector, because water is an essential part of making hotels operate. So the sustainability future investments potentially are hampered. And this is happening in areas, environments that are also already under water stressed conditions. Next, please. So this is just an example, a community close to a large resort where people now have difficulties accessing water. They have to wait and line up for a long time. The taste of the water may be influenced by saltwater intrusion. So these people will face a difficult or basically an uphill struggle accessing water. Some have to move further inland, some have to face ways of coping with water shortage. Next slide, please. So what we need to do is a diversity of things. And some of the examples could be that we simply need to integrate and enforce standards for sustainable tourism. That can be in the international hotel sustainability certification systems. We need to take water use efficiency and energy use for water much more serious in the entire marketing and supervision of investments and operations into hotels. We certainly can gain a significant return on investments by investing in updated technologies, reducing water usage, circulation systems, using wastewater for treatment and recirculations for gardening. And of course, we have to make more energy efficient ways of doing this. We also see examples of national policies and pricing and taxation systems moving hotels and the tourist sector in a direction of a more water efficient, less wasteful use of the resource. So it's not just technology, it can also be supported by pricing structures. We see that training in a number of the places we work, training of future professionals in the sector at colleges, universities, technical schools is also a way of influencing future management and uptake of technologies. And then, of course, we also need to look at all of us who are acting as tourists. We also need to increase awareness, the perception and practices of tourists once they get to the destination, but also at the point of purchasing their next travel abroad. Awareness needs to be much higher. And also across the tourist sector, we need to work much more significantly, investors and operators, looking at the negative impacts of excess water use and the lack of sustainability in this sector. So enormous opportunities as well as an enormous problem, but great opportunities for getting a high rate of return on investments. Next, please. So that was all for the two cases, hospitals and hotels, for a lack of water to an excess water. And over to you, Anne.
Thank you, Flemming, and thank you, Gifty, for those really interesting presentations. I've encouraged people who would like to ask you questions to put up a hand or type it in the chat on the session page. But in the meantime, while we're waiting, maybe I could ask you to reflect a little bit on the case study that sort of inspired us to put up this session. So in a community where there's plenty of access to clean and safe drinking water, and they're not using as much as you would recommend for the daily use, do you have any experiences on what kind of interventions can help improve the use of safe water?
You want to go first, Gifty?
You can go first for a minute, it's okay.
Yeah, so some of the things we see in terms of facilitating increased use of water is, of course, distance. It's not across all settings, but we can see that taking water into the household, into the compound, are increasing water use. So when it's more than 100 or 200 meters away, it already there impacts on use. So getting water very close to the point of use increases consumption. Of course, we also see that heightening awareness about the importance of hygiene in food preparation, in personal hygiene and other elements of hygiene, awareness also may facilitate use. We also see a diversity of water resource. So sometimes for laundering, it has to be a particular resource. Other places, it may be for domestic drinking water use. So differentiating between water sources and their particular qualities may also influence use.
Thank you. I have Manon Renfer. Could you perhaps put on your microphone and ask a question? Manon? There's also Helvi. Ah, great. You're there. Could you ask your question, please, Manon? Your microphone should be on. Ah, in the meantime, I have a question from Switzerland. Do you have numbers on how much water is necessary in humanitarian settings?
Of course, we do have some rough numbers, and they vary according to setting. We also estimate that if people have access to, individuals have access to less than 5 liters of water per day for an extended period of time, it's not possible to maintain a hygienic standard that prevents disease from spreading. So 5 liters would be an absolute minimum for several weeks at a time. Else we probably have to get much closer to 20 or 25 liters per capita to make sure hygiene is sufficient.
Great, thank you. And Helvi, I'm going to give you the microphone to ask your question. I don't hear you. Ah, Helvi, could I ask you to put on your microphone and ask your question? Okay, I think we'll take one from the other chat. There's one that says, are the hotel managements open to change their overuse of water? They might place the level of service in front of the community needs.
Yeah, and that is a very good question. And of course, they would need incentives. They for some, and that's an increasing number of hotels, they see they simply have to close business. They have to close their hotels if they don't change practice. So that's, of course, a very high level of incentive. So some are now facing increasing costs because they have to bounce in water for a long distance. People complain about the taste and access to water. So of course, we should put in place incentives before this more desperate need arises. But we do see, if we work with hotel management, that they become more aware and see that there's a need, especially for introducing new technologies that can save on pumping cost, cost of water use overall. So combining energy cost of water with a more sustainable approach, that may convince top management at a hotel.
Great, that's excellent. I don't know if Helvi, if you fixed your microphone, do you want to ask your question? If that's not the case, I want to thank you all for participating today, and we will hang around in the chat on the session page to answer any other questions you might have, so feel free to post them there. Thank you and have a lovely day.